Diarrhea. Today we in Europe mark Rare Disease Day to acknowledge the difficulties that an estimated 30 million Europeans are struggling with every day as they go through life with an illness that might affect fewer than 1 in 2,000 people. This includes rare forms of neurological diseases, metabolic diseases, intellectual disabilities, certain cancers, rheumatologic disorders, complex epilepsies, immune deficiencies, and auto-inflammatory diseases. Some rare diseases can progress differently in men and women, with the result that outcomes and long-term effects may vary based on gender. One of the most frustrating things about having a rare disease is the difficulty in getting that initial diagnosis. On average, it takes 5 years for a patient to get a diagnosis, if one is made at all. And that is a problem that is compounded by gender biases, which are present in our systems of healthcare. Further research is needed to identify and address the roots of gender discrimination in health. However, we know from patient testimonies that female patients often do not have their symptoms taken seriously by their primary healthcare provider. Women are typically directed to a hospital or specialists later than men, following the onset of symptoms, and that delays diagnosis. This late access to the healthcare system causes distress for the patient, but it's also costly for the women affected and the system. On top of this, men suffering from a rare disease can benefit from symptoms management before diagnostic confirmation, which is often not the case for women. This has long-term impacts on the rate of progression of diseases, severely impacting the quality of life, the socio-economic status, and the mental health of the sufferer. We in the European Union must address and create awareness around the problem of unconscious bias in research and healthcare. We must support our healthcare providers through supports for training and ensure new entrants are not relearning old biases. Further research is needed to identify and address the roots of discrimination in all aspects of the health system. It is only through a comprehensive approach encompassing all aspects of gender inequalities that the European Union can alleviate the suffering of all those with rare diseases.